Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clipboard product.
This is a clip on the medial muscle compartment of the thigh.
You can see our anterior compartment here, so we've moved more medially here, and we can see our medial compartment. As we can see, these muscles tend to cross the hip medially. Therefore, these will contribute to hip adduction.
So the medial compartment of the thigh can be thought of as the hip adductor compartment. Here it is shaded in orangey yellow. Boundaries, of course. Muscle is encased with deep fascia. We have the medial intermuscular septa being its anterior boundary, and adductor magnus going between those two compartments actually, forming the posterior boundary. Common actions of the medial compartment are hip adduction. Common vessels are the obturator artery and obturator vein. Internal iliac artery pass through that obturator foramen where they become the obturator artery. The obturator vein, of course, starting distally and going back. Common innervation is by the obturator nerve. So the muscles of the medial compartment, we have pectineus. It's not actually on our transverse section because it's up too high. It's too proximal to be seen at that section. So it's innervated by the femoral nerve. Some people consider the pectineus to be an anterior compartment muscle because it flexes the hip and is innervated by the femoral nerve. We can consider it to be the medial compartment because it adducts the hip joint. So just be aware that it can be considered both anterior and medial. We have the gracilis muscle. This is also a knee flexor. So it attaches posterior to the knee at that pes anserinus or goose foot landmark and causes knee flexion. Other muscles, we have the adductor longus. Remember that it forms a boundary of our subsartorial or adductor canal, adductor longus. Deeper we have adductor brevis and adductor magnus. Adductor magnus can be thought to have two parts. It has an adductor part, and in the posterior compartment, as it encompasses both, it has a hamstring part. So the adductor canal starts off in the anterior compartment, but it's an adductor canal, so it is moving medially and can be thought to also be part of the medial compartment. So opening superiorly, that femoral triangle, inferiorly the popliteal fossa posterior to the knee through the adductor hiatus. Function of anatomical spaces is a communication or a passageway for nerves or vessels to pass through. Now that you've reviewed the muscles of the medial compartment, fill in this table. Look at each muscle, note its origin and its insertion, look at where it gets its blood supply and its innervation, which joint or joints it might cross, and where relative to the joint it crosses, and use those to work out the action at this joint or joints. So for gracilis, for the adductor longus, brevis, and the adductor magnus, the adductor part, as well as the pectineus muscle. As usual, post your answers on the forum and discuss. Thank you very much.